12 on your health. The passing of actor Eric Dane, increasing awareness about ALS, also known as Lou Gehrig's disease. WXII 12 Sarah Sowers joining us in studio with some of the most common symptoms and how you can spot them.
ALS doesn't have a cure and can often remain undiagnosed until it's too late. The most common symptom, feeling weak or having trouble with everyday tasks like holding a utensil or walking.
Patients will come in saying things like, I'm having trouble walking, or I'm having difficulty picking up a cup or putting on my clothes, even having trouble swallowing or even breathing. So that's the first thing that we see. Those are big red flags.
ALS, also known as Lou Gehrig's disease, is rare but should be taken seriously because there is no cure.
There's a lot of research going in to try to find better medications that can possibly slow down or even halt the disease altogether. We're just still not there yet.
Difficulty swallowing, excessive drool, and extreme emotional responses that are out of character may also be a sign of the disease. Dr. Stephen Coburn with Novant Health says anyone could be affected by ALS.
I've had folks in my practice between the ages of 18 all the way up to 80. But typically it's seen in the older generation, that 55 to 75.
He says the symptoms are painless and patients won't feel numbness or aches in their muscles even if they lose control of them. Through any kind of diagnosis, Coburn says having a support system of family or loved ones with you during doctor's visits is vital.
There's nothing more important than having someone to help you cope with during that time and during this diagnosis.
He added that the best way to get checked for ALS is to talk with your primary care provider about any potential symptoms you may notice on yourself or a loved one.